I guess we'll start off really simple. What's your name?
Hassan Moghadam,
What's your specialty?
oral and maxillofacial surgery.
How many years have you been practicing?
I graduated dentistry in 1995, got oral surgery 2002, so I've been practicing oral surgery 22 years now.
Where'd you go for undergrad?
McGill, I did 1 year in the pre-dentistry program, and then straight into dentistry.
Did you take any gap years before medical school?
Never. Dental school.
Dental
not
school.
medical school.
What was your favorite part of dental school?
Favorite part of dental school? Probably working with the tiny little things and waxing up all the teeth and doing the fine. Like I had drills. I felt like I was like in like an airplane cockpit. Like I had all these tools, all these buttons. I thought it was really cool.
What first made you fall in love with dentistry?
I used to love doing stuff with my hands. I used to love making models, model cars, model airplanes. And so dentistry had that like tiny miniaturization part of it and building things. So I like that part of it.
How long does your training take after dental school?
So I'm going to make some tea here for a second. Here, I'll just put it over here. Dental school, after dental school, after dental school, you have to do a 1 year general practice residency for Canada, so it's called the GPR year. All right, and then you can do oral maxillofacial surgery, which in my day it was 4 years, and in there you had to do a master's program. So that would be kind of like a 4 to 5 year. Today it's 6 year MD, and that's it.
Right. Are you in academics or private practice?
Both. I teach at University of Toronto in the graduate periodontal degree. I had 2 master's students I was supervising. I teach at McGill undergraduate. I do some research at U of T, and then I'm 4 days a week in private practice. And I work at the hospitals.
Which one do you like more?
I love the mixture, actually. I love it because it gives you a break from, doing surgery all day, hardcore, kind of gets tiring, and then doing the academics is fun because you get to really be around young people, and they're like all really keen. Like they love being where they are. So it's not like you're teaching high school kids. These kids want to be there. They're always asking you questions. They're super curious, and so it's really nice.
Are there any cons about private practice over working in a hospital?
Cons in private practice where you work much harder. You see many more patients. The patients are more picky because they're coming in and paying privately, so they're demanding patients. So it's physically, more demanding that way. But the hospital stuff is, you see less patients. It's more relaxed pace. You see more complicated patients, probably more difficult medical history patients.
Did you ever consider getting any extra degrees like an MBA or an MPH?
Yeah, I did a master's, but I had enough work for a PhD. So I thought of maybe doing a PhD. And if I could do it again, I would do a fellowship in a very specific area. So I did my master's in bone engineering. I would probably continue my PhD and do a postdoc in that. And then if I really had time, I would do an MBA at Stanford. And then go through their incubator to create a startup. That would be my dream.
That's awesome. What would you say is the most unique part of your specialty?
It's kind of really cool because I get to put people to sleep and do surgery at the same time, which is very, very unique. We're probably the only specialty in the world that does anesthesia and surgery combined. And it's kind of a tough area because in the US they're trying to, anesthesiologists are trying to stop us from doing that because they're saying, how can we monitor the patient at the same time as doing surgery? But we have an excellent track record. Our track record is as good as a medical anesthetist because we choose healthy patients, and we're, of course, very well trained, and we're careful with the kind of cases we do. So case selection allows us to be very successful and safe.
All right, here's a hypothetical. I'm an undergrad student. Why should I choose your specialty?
My specialty is probably the best specialty because it allows you to be an anesthesiologist, it allows you to be a surgeon, it allows you to be a dentist. So you mix in medical and dentistry all together. From the ability that you can put people to sleep, you can do a lot more cases, and the patients don't complain of pain. So as a dentist, they're always, I feel the needle, right? With me, my patients are asleep, so I don't have to deal with that. So Those are the amazing things, and then you have, from an income point of view, it's very, very rewarding financially as well.
Why should someone not choose your specialty?
If you can't handle stress, you got anxiety, get out.
Gotcha. Are there any stereotypes about your specialty?
Yeah, so it was up until like a couple of years ago the specialty with the least amount of females in the world. So very few women used to go into it. Now there's a lot more women going into it, as they are in every medical specialty. So it used to be very male dominated, and it's not anymore, which is good. There's a much more diverse background. The other thing, it's very high stress. So they used to say, all surgeons have the highest rate of divorce, highest rate of suicide, all that kind of stuff, which I don't think is the case.
On a more positive note, from a student perspective, even though you work in private practice, are you still able to interact with students?
Yeah, because I have an academic appointment. And if you're ever at a teaching hospital, you have residents working with you. So that'll. But if I was 100% in private practice, I would not.
What's the craziest question you've asked a student?
Craziest question I've asked a student? I always ask them anesthetic questions. What's the maximum dose of local anesthetic? But I don't know. I'm probably careful. I don't ask really bad questions.
That's a good thing to hear. In your experience as a student or as a resident, what's the craziest question that you've ever been asked?
Well, this week I was operating with two plastic surgeons, and we were doing this jaw wiring case and jaw fracture, and then they're like, Dr. Moghadam, can we ask you a question? I'm like, what? It's like, well, it's like a little bit personal. I'm like, okay. They're like, can you tell us about your car collection? And so we discussed that during the surgery.
That's awesome. Are you ever nervous at all coming into your clinic or just work in general?
Yeah, I mean, every case is unique. Sometimes you have really difficult patients that are very demanding, or when a patient's really upset at you for something that they feel has not been ideal, then it gets harder to deal with. Yeah.
All right. Let's talk some numbers. How many patients do you see on an average day?
About 40 to 50 patients.
How many procedures do you do in a typical month?
Month I wouldn't tell you, but I would say 10 to 12 surgeries a day is a minimum.
How many hours do you work in an average week?
It's 8 hours a day times 4.
Nice. What time do you normally wake up?
My routine, which has taken a while to get to, I wake up at 5:30, down at 6 having breakfast. I have a matcha with oats milk, and then I have to read a book for an hour, 6 to 7, and then 7 I get in the car and I go to work, and I'm at work at 7:30.
Nice.
And I have to be at bed around 10.
Sorry. What time do you normally leave the clinic?
Usually I'm supposed to go 7:30 to 3, but by the time I'm out, it's about 4.
So how many hours of sleep are you typically working on?
Oh, you got to get a lot of sleep. You can't function without good sleep, and because I wake up early. So I try to get a good 7 hours or so of sleep.
How many hours of sleep are you working on right now?
Oh, no, I did all right. Probably 7 hours.
Nice.
Okay.
That's good to hear. How long does it take for you to finish your patient notes at the end of the day?
I try not to do anything at the end of the day. I try to do it as I go along.
Who are you most thankful for in your team?
All of our staff, from the front desk to the cleaning lady, to the sterilization lady, to our dental assistants, to our nurses. It's our whole team, right? Like, I'm only one part of it. And don't forget, the person, like, I'm doing the surgery and I'm like, oh yeah, I get tired. But the person on the other side of the surgery, your assistant, does exactly the same thing you do. So they're also as equally physically demanding on that. So yeah, you have to be. Without the team, it's nothing. Right? You can't do it.
All right. What's the funniest thing you've seen in a patient chart?
I had a guy came in from Iqaluit, and they're supposed to not eat or drink for 8 hours before, right? So then we can operate. If you eat, I can't operate on you because you can vomit, it goes in your throat, you die. So very strict rules on not eating or drinking before surgery. So the guy, I'm like, so he comes in, they fly him in from Iqaluit, I'm ready to do his big jaw fracture, he's been beaten up and everything. And I'm like, okay, so did you eat? He's like, yeah. I go, what do you mean you ate? He goes, I had a milkshake. I go, why did you have a milkshake? Because it tastes so good. I have to have a milkshake. So I just died laughing. This poor guy. So I'm like, okay, we're going to cancel this surgery. Yeah.
What's your favorite nerdy random medical fact?
Random. The switch for sickle cell anemia, valine for alanine on amino acid number 6. I don't know why I really remember that. That's what I remember.
I think we learned that in biology class.
Yeah.
How has your specialty been impacted by COVID?
We just got busier.
What's your favorite thing to do when you're not working?
Collecting cards.
Nice. Do you have a significant other or any kids?
Yes, my wife who runs clinical trials for pharmaceutical companies, and then I have 3 kids, 21, 19, 17.
Great on the ages. Does your family ever ask you for random medical advice?
Probably not, because they know that I'm going to come down hard on them.
What is the weirdest question a family or a friend has ever asked you? It's all good. Do you have any pets?
No.
Are you a dog or a cat person?
No. My kids are my pets. I tell them they're like a dog. So
All right.
that's it.
What is your favorite animal that isn't a dog or a cat?
Favorite animal is the time. Maybe a finch.
Nice. If you could have dinner with anyone in history, who would it be?
Jeff Bezos.
What would you guys be eating at that dinner?
Persian food.
Nice. What's your favorite dish to eat?
Kebabs.
Nice. Do you have any favorite restaurants around here?
Ayla's Social Kitchen in off of Preston.
Might have to check it out.
Yes.
Are you a coffee, tea, or soda person?
So I generally don't drink coffee. I love tea, as you can see, but I'm trying to open up a coffee shop because I love the whole vibe of a coffee shop. So my plan is to create a coffee shop with vintage cars and bring the community together.
That's awesome. Sounds like a great idea. How much water should you be drinking every day?
I generally don't drink any water at all,
All right.
but I drink tea. So,
Yeah. What was your favorite meal as a kid?
Big Mac,
What's your favorite healthy snack?
ice cream,
Ice cream. What's your favorite guilty snack or cheat meal?
ice cream.
Ice cream? Nice. Pineapple on pizza. Is that a yes or a no?
No,
No? Are you an Apple or Android user?
Apple.
Apple. Do you have any hobbies that you keep up with?
Yeah, so I mean, I'm a big car collector, as you guys already know. So I get into the small details of very, very rare and vintage collectible cars.
Right. What's your favorite car?
Alfa Romeo Tipo 33.
Nice.
Probably the ultimate car in the world.
Awesome. What is your favorite place that you've ever been to?
I've been all over the world. Probably my top place is climbing the mountain with my boys at Lake Louise.
All right. What is your dream vacation?
Hiking Everest, base camp.
Nice. What kind of music do you listen to at the clinic?
I always listen to sad music. I work out the Billie Eilish.
Is there a reason for that?
Emotional. I love anything emotional.
What's the best way that you relax after a long day?
Go for a run.
Nice. Are you a night in or go out on the town kind of person?
Night in. So I'm a nerd.
Indoors or outdoors?
In what way?
In just spending your time.
Outdoors.
Outdoors? Beach or mountains?
Mountain.
Mountains. Would you consider yourself more of an introvert or an extrovert?
Extrovert.
Do you think that personality trait was a factor in you choosing your specialty?
Yeah, because you need to be able to deal with people, and you have to be a people's person if you want to do this job and like it. If you're not a people person, it will really wear you down.
Right. What did you think that you were going to be as a kid? Were you always dead set on this career path?
I actually thought I was going to be a medical doctor. I really wanted to be a medical doctor. Actually, before that, my dream was a biomedical engineer. Because I created a mechanical arm. I won a science fair, and I wanted to go. But nobody knew what biomedical engineering was back then. So I didn't do it. And funny enough, I'll tell you a story. So that was my dream. Until this day, I was saying that's what I should have been. And then I met a biomedical engineer on vacation last week in Greece who worked on the same kind of stuff I wanted to work on. And it ended up that he was begging for a job, and he's like outdated and not doing well. I was like, because as an engineer, you're always dependent on a company for funding to run your project. Whereas what I did is I had the money and I had the idea, so I hired an engineer to develop my product. But if you're an engineer, you can't do it because you don't have the funding. So now I realized, as an engineer, you're always relying on somebody with financing to give you a job or to create the company. Whereas if you can do the medical side, have enough finances, and then you can fund your own dream medical startup.
Yeah, awesome. Is there a different specialty you think you could have done?
No.
Is there a reason for that?
I'm really bad at reading and writing, and I'm only good at doing stuff with my hands. So I would have never survived in a environment where I have to type or write or be on the computer, and I didn't know that at all. But it's like this specialty found me, and I thrive at it. But I would have been terrible at the other stuff, and so it just naturally felt that I was in the right place. But I didn't know that before. I didn't know what my weaknesses were. Now I know what my weaknesses are.
I see. That's a really interesting way of putting it.
Yeah.
If you didn't do medicine or anything STEM related, what do you think you'd be doing right now?
I would have done business.
Business? Nice. Were there any times that you doubted that you would make it as a doctor or a
Of course. I remember sitting in the head of my programs. I'm like sitting in his office, fourth year oral surgery, and I'm like, I have to finish my exams, I have to defend my thesis, and I have to write my fellowship board exam to get my license. I said, how am I ever going to finish all these things? It's impossible. I can't see myself doing it. And he's like, yes, you're right. You're going to get through it. I know. And it's like, when you have all these millions of things that are coming at you, and I talk to my kids, write it down on a piece of paper, make a list, and then one at a time, check it off, attack one thing at a time.
If you could change one thing about the medical field right now, what would it be?
I think medical doctors, unfortunately, are really, really underpaid. I think they should be the highest paid people in the world. And that's not me. I'm talking about medical doctors, seeing patients, in the hospital, all that stuff. I think it's really a shame that these people that are so smart, so hard to get into medical school, and they're the best of the best, and they're, unfortunately, because it's a government paid situation, the government doesn't have the money to pay them. And I really hope that these smart people still go into specialty because they love it, and somehow they eventually get satisfied.
Right. So in terms of a student perspective, what can medical students or dentistry students do right now to prepare for your specialty?
I don't think you need to prepare for the specialty. I think, once you get in, is the hardest part is getting accepted. Right? So that's a whole other world that you guys will play with. But I think, really, if I can give one set of advice, is learn social intelligence. Understand how to read people. Understand, and I was very naive and I didn't know how to do that. And technical skills you all learn. It's like putting the Lego kit together. You get manual, you do the surgery, you do it 4 or 5 times, and then you get it right. So learning how to do surgery is not the problem. Learning how to deal with patients and that whole social intelligence, I think, is important. So I think if you can develop yourself socially, that's what you need.
Awesome. If you were to go back, would you change any of the experiences that got you to where you are right now?
I think one thing I tell my son who's at McGill, I'm like, I was a huge nerd, and I studied so much, and I never enjoyed university because I never went out. I didn't have a lot of friends. I lived at home an hour away, so I didn't live on campus. So I never had a real university experience. And if I can tell you guys it's the best years of your life, and you won't believe me because you're struggling to get good grades, you're not going to have that same feeling. And it's not to say that you miss out, but I really think if you can really try to enjoy as much as you can out of your university experience as possible, I strongly recommend. If I can go back, that's one thing I would do differently.
Yeah, that's some great advice. So last question to wrap us up. What would you say to any aspiring surgeons that are watching this video right now?
So just to know that, I'm a maxillofacial surgery, and I went through dentistry, but general surgery, neurosurgery, they're all the same, right? So it's all about the same skills. And what would I say is that, one, never give up. If you really want to do it, you will get in. You go out of the country, you go to Australia, you go go to England, go wherever you have to do to get the specialty and come back. I think we have an amazing system here so to live, and the surgery here is amazing. And I think that if you really want it and do it because you love it. One thing I'm going to tell you is this guy was, do you have time on this thing? Yeah, this guy was a multi-billionaire, and he sat down and he says, all these people that tell you go follow your passion is bullshit. Okay? He's right. It's not like, oh, my passion, I want to be a surgeon. There's hard stuff to go through. Okay? So it's not like saying, oh, it's my passion, I want to be a surgeon. There's a lot of hardship to go through. You work hard, you get in there, and then you find a way to enjoy it. Not every job is all, rainbows and sunshine. It's not like, oh, follow your passion. It's like, do something that you really want to do, work hard, you got to have a good income, and you got to make a difference in life, to other people.
I see. Awesome. Well, on behalf of the Pump team, we'd like to thank you for sitting down for this small interview, and we hope you have a great rest of your day.